Are you a third year student soon to complete your bachelor's of degree in nursing? If yes, this presentation would be quite helpful for you to understand how proper communication in ED could result in patient safety and healthy workplace. Understanding this topic could be fruitful towards your further journey of starting a career as a registered nurse, or also if you're transitioning as a new graduate nurse in few months. My name is Regina Shrestha and I'm a third year Bachelor of Nursing student who will guide you through this presentation. So there's a short link of video that demonstrates communication in ED. There's the link that you can follow. So now I'll further explain about the clip. So on this video you could see how the doctor emphasizes that the communication is the key in ED words. It also stresses how frustrating and tenuous the process of finding out the backgrounds and history of the patient could be. However, it also signifies the need to ensure that the information transmitted are all correct for correct diagnosis and treatment. Hence, from this we can see how any sort of ineffective communication along the line in stressful environments such as ED could hamper patient safety, which could also lead to unhealthy working environment. So why is ineffective communication a problem? So failure of effective communication is one of the most common sources of adverse events in healthcare. So ineffective communication can result in severe adverse effects like interruption in care, bargain of patient safety, patient discontentment, increase in hospital admission, unnecessary treatment expenses. And the causes could be differences in culture, education, and way of communicating, hierarchy system among nurses and different junior staff or health professionals, cognitive overload of information in ED, and also it all results into psychological distress that causes nurse to reduce the work for satisfaction. So what is being currently done about it? So throughout the health sector and ED, we can see the execution of checklist and readback policy alongside structured communication process such as ISPAR during team debriefing, which ensures common agreement, reflection on how every team player worked, and opportunity to share concerns and ideas. Also, the use of electric systems such as e-meds to dispense, prescribe, and administer medication also reduces potential medication error by facilitating the knowledge about the medication itself. Also, in a study, it was found that relaxation interventions such as massage and aromatherapy is found to be effective to reduce short-term anxiety in ED nurses. However, it is important to understand that different ED have different stresses and the solution of the stress should be tailored. So what could be done? So first you can identify the root cause analysis, and then some examples that could help reduce those stress would be promoting extra staff support, increasing staff autonomy, counseling, mindfulness and meditation, cognitive behavioral therapies, and for complex cases, tertiary level of intervention such as occupational health professionals should be contacted. So why is it a significant issue towards patient safety and workplace? So working in a team requires coordination, mutual understanding, and proper communication. However, poor teamwork results in rise to error and dissatisfactory outcomes in patient care. Additionally, communication error could also result in serious complications such as wrong diagnosis, infection, wrong treatment, medication error, and also detain the ability to determine deteriorating patients. Furthermore, it was also found out that in a study of 459 patients, 28.8% were affected by poor handover, where 90.2% were affected by missed critical information, causing in the year 2015 4.9 billion of annual income in lack of communication between nurses, and also 6.6 billion annually due to hospital overstay and extra resource uses. So how can effective leadership mitigate this problem? So an effective leader should be able to communicate within the team to attain appropriate outcomes by allocating tasks appropriately, explaining the task requirement and plans by sharing information, providing feedback suitably and communicating comprehensively, offer and appeal assistance in times of need, trust and have confidence in other team members, evaluate ongoing team performance, and use of closed loop communication and blame-free environment. So Moving forward, you can also use teach back methods and show me communication skills. So the teach back communication skill is easy and effective, where the health professionals encourage the consumer to reciprocate the information that was discussed, and show me is where the health professionals request the consumer to show how they do certain things, such as swallowing the medication, which could be part of an important care plan. And also, you can be a good communicative leader by teaching and learning de-escalating technique for challenging behavior, by boosting communication skills in nurses through paraverbal communication, such as minding tone, volume, having a relaxed body, maintaining ordinary facial expression, relevant eye contact. You share simplicity, honesty, authenticity, rapid and empathy, and also simple languages and short sentences, and also silence. So what is the background of the issue? So the emergency wards are known to be high pressure wards to work in. The stress causes escalation in sick leave, early retirement, and excessive staff turnover, which degrades the working environment. 1.6 interactions of communication in a minute is done by a ED nursing team leader. Also, this kind of chronic exposure to stress leads to depression and anxiety, resulting in substance abuse and burnout syndrome. The stress also leads to disturbance in sleep, gastrointestinal problems, and fatigue, which directly or indirectly hampers patient safety and work satisfaction. So, I'll also talk about some of the background issue with effective nursing and ineffective nursing. So with effective nursing, the patients have enhanced vital signs, reduced anxiety and pain, enhanced satisfaction and treatment result, and also the emergency department runs smoothly and in organized manner with good patient flow. While critical outcomes are uh, a result due to substandard handover and ineffective communication, which are prolonged time in diagnosis, increased length of stay for patient, 84% of delays in treatment, and workplace violence results in amplification of job stress and diminished job satisfaction. So, health professionals working in ED did not take any advantage of communication technique to build good communication with their parents, which can be a background for these kind of ineffective issues. Also, lesser than 40% of the health authorities use teach back method, which is very easy and among the safest practices. And also, interprofessional hierarchies has found out to be unfavorable effect on communication and opportunity to work collaboratively. So the way the physicians and nurses were trained to communicate are totally different, leading to frustration. For example, physicians are trained to be concise, where nurses are trained to just do the opposite. So as a responsibility of a new grad to maintain effective communication, it's better to ask questions during handover when the information is not conveyed appropriately, as questioning helps to develop interactive practice for a constructive communication, minimize unfortunate events, decrease treatment errors in subsequent shift, clarify any doubts, reduces medical error, and improve quality of patients' healthcare. Also, by developing professional confidence, which is an essential attribute as a new grad nurse, it helps to avoid mistake, become independent, and develop good and positive relationship with staff and families. Also, by two-way exchange of knowledge through staff and patient, being empathetic, involving patient in decision making, and developing rapid relationship by being clear and honest can also help maintain effective communication. Also, in situations of violent behavior, we can improve our communication skill as a new grad by calming the patient down and the visitors by speaking in soft and non-threatening voice, and endorsing de-escalating strategies such as active listening and silence. So, as a new grad, the responsibility to educate my peers and family, their patients and families are vast. So nurses are an important source of health information to the consumers, and it's also one of the standards of practice and contemporary nursing practice, which can be done by advocating for the patient even when the other healthcare staff are not receptive about your concerns. And when you do so, it would be better to access and make use of best accessible resources and research finding to ensure safe practice. Because every health professionals need to be conscious to provide range of approach to reduce the health literacy levels, as it has been approximated that consumers having lower level about health are thrice the risk to experience adverse health results. So how ineffective communication can harm patient safety and health first, and how as a new grad nurse you could use some of the effective communication skill to boost patient health outcomes and workforce environment. These were the topic that was discussed, and I have portrayed those information through evidence-based research that includes systematic review article, peer review, research with qualitative and quantitative studies, policies and standards of practice set upon by Australian Board of Nursing, and use of practice pictures and videos that makes the presentation engaging and interactive. So now, do you think you'd be able to deal with ineffective communication in your workforce? So that would be the end of my presentation. Thank you.